Thank you, Tim.
Thank you.
Appreciate it.
You bet, buddy.
Well, welcome everyone. Again, my name is Jon Schultz with Optimum Performance Physical Therapy. This is a little presentation that I prepared for you guys, but definitely want to thank Brian and Tim and Claire and all the staff at Healthy for Life. You know, they really kind of believe in, like he said, the holistic care. They've helped a lot of my clients with pain issues, inflammation issues. I work a lot with athletes too, so they've helped a lot of my athletes increase their performance with the oils, and I know a lot of you guys are pretty familiar with that. A little bit of just the learning objectives. You know, we kind of advertise this as try to learn low-cost secrets to avoid drugs, injections, and surgeries. Not to badmouth those, but for a lot of us, especially clients here, they want to kind of live without some of those because of the side effects. So some of the objectives, I want to talk about standard treatments, kind of very briefly, what Western medicine offers. And then I want to kind of go into more talking about alternative treatments that I kind of offer, and definitely we'll finish up with some low-cost tips. I mean, that's the main reason why I think maybe some of you might have had some interest and wanted to come here. But I also have to provide a little bit of background. Don't worry, there won't be a quiz on all the muscles and ligaments and bones, but that's kind of my specialty. And knowing this helps you to move optimally, not perfectly. You know, it's kind of like posture. None of us has perfect posture. Couple background things. I want to try to keep this presentation 15, 20 minutes. It's a small, intimate crowd, which is great. So if you have questions, please interject, ask me. If they flow, I'll answer them right then. We might have to table them, take them offline, but I will address your questions at the end. We'll also, if you're interested, I just open up at the end, just a quick little tour, but I also want to just open up at the end after I do a little bit of brief demonstration of how I kind of do a little bit of an evaluation and what I look for. I really want you guys just to pepper me with questions. Feel free. Come on in. Feel free to pepper me with questions. You know, again, there's no charge, no copays, deductibles, any of that. No money will be exchanged. I'm not trying to sell anything. I do have a balance class, which I'll say, and I'll throw my dad under the bus. He recently just fell. Do you mind if I just tell? He had a little fall. Okay. It's a long story. But, you know, again, my concern is for people falling. And I see, I think there's huge issues related to falls and the sequela with that. So without further ado, I'll get started. This is a new presentation mode. This is called Prezi, which is much more interactive, color pictures. You're not going to be subjected to a lot of bullet slides. I wanted to keep those at a minimum. So I kind of already went over my agenda for today. This is a picture. Can we turn the lights, or is there any ability to do that a little, Brian, or how does that affect filming or anything like that? This is a picture of an Oldsmobile Tornado. It's not the actual car that my mother was involved in a car accident, but it kind of gives a little bit of background on why I do what I do and why I'm so passionate about it. She was, this was, I don't know, 40, 45 years, quite a number of years ago. So she was involved in a serious car accident. Went through just a number of procedures, actually ended up at Mayo Clinic where they put her on a lot of narcotic opioid medicines because, you know, that's kind of how they treated everyone back then. And I think we all know what's going on with the opioid crisis and a lot of that. So back then there was not a lot of study on chronic pain. There wasn't a lot of alternative solutions to it. So with my mother being injured, it deeply affected our whole family. It changed the trajectory of her life, our lives, but I became very passionate and trying to help people get better because I saw all the suffering she went through, all the changes. And I mean, it has a good ending. She's now still working as a clinical social worker who's certified in drug and alcohol counseling. So I mean, it's amazing how that full circle comes. I actually worked in Rochester, Minnesota, and learned a lot from this. I didn't work at Mayo, but I worked with a lot of their providers, and it was kind of interesting because their chronic pain program, their whole goal is to get people off opioid medicine because of something called hyperalgesia, or the longer you take it, the more the opioids actually become less effective and your pain increases. So it's kind of interesting how things came full circle. Okay, no, I want to go back. So again, this is what we're here for. Learn some low-cost secrets so we can stay active, maintain our independence, and live free from medication, invasive surgeries, or painful injections. Robin, great point, and I'm not throwing doctors under the bus, but the way a lot of these practices are set up, they own their own physical therapy practices. And again, so Dave could go do that, and I think some of the physicians would be open to that, but a lot of them want, you know, their patients to go to their therapist. And so a lot of what we're trying to do is, I'm glad for you guys showing up, it's got to be a grassroots effort. It's got to be what Healthy for Life is creating, is we're creating a community of providers who can work together and cross-refer. So I love to work with nutritionists and good trainers and good health coaches, because that's the way we're going to do it. It's going to be hard to change the revolution, because I've gone into orthopedic surgeons and said, you know what, and this was when I was young, I can reduce the number of surgeries you're going to have to do on shoulders, and I can block. And the doctor's like, really? Why would I want you to do that? And again, I want to tell people, I had a patient who fell and fractured his elbow riding a bike. It sounded like glass. This surgeon, Dr. Rogers, I'll point him out, DMOS, hand, elbow surgeon, he repaired it. He can move his arm, it functions, he's in his profession. So I don't want to become off like I'm anti-physician, anti-surgeon, but I mean, you have to remember they have 60, 70 patients a day, and they're trying to find someone who's surgical. So they don't have the time necessarily to really ferret that out or sort that out. So great question, Robin. Yeah. You know, the big thing is staying active, independent. You know, a lot of us have grandkids. You know, we hope to have one time. And by the way, this is Leslie, my lovely wife. And without her, I wouldn't be able to do all this and run a practice. She is our office manager next door. So she's the glue that keeps this going, and she keeps me functioning. And that's a full-time job right there. But we really want people to remain active and enjoy their lives. I kind of joke Tim, because he's a young guy back there, but he's in his, you mind, 60s. And if you look at Tim, he's not up here on the picture. Let me see if I can escape out of here. I kind of look at this guy right here. I mean, he looks a little older. He's still running. He's still in the game. There's really no reason why, you know, you can't stay active out into our older years. Put this back in the presentation mode. There, optimal movement. Sorry about that. I'm just going to put this back in the presentation mode. There you go. All right. No, we don't want to go through there. We want to avoid walkers and wheelchairs. This is an interesting fact. Americans consume 99% of all the hydrocodone worldwide. So we really look, is there an alternative to that? We spend over $874, is that billion? I think that is $1 billion, treating low back pain related to disability. So again, it doesn't sound like we really have it figured out how to best treat this. Surgeries, if you want to go get a knee scope, oops, sorry, I'll put that back there. It's about $5 grand, rotator cuff $9. This is, and a fusion of your back is $50. So huge money cost, not sustainable. This is a slide that I got from Blue Cross, actually. This is people under the age of, I believe, 65, yes. They've gone up, total knees have gone up 17% in that age group the last 7 years. Hips have gone up 33%, cost 6%, cost on a hip 5%. You're looking at $22,000 for a hip, $19,000 outpatient knee, and it's 44% increase in cost for, this is below 65, having a total hip. So again, it doesn't seem to be a lot of concern in the medical community about how to prevent this. And so, you know, partnering with Healthy for Life, taking a little bit more proactive, preventative approach is definitely going to help with that. All right, so, oh, not good. This thing's working. Oh, all right. I have to do a little one-on-one here. So when we look at prevalence of musculoskeletal disease and we compare it to like heart disease, diabetes, and cancer, musculoskeletal disease like dwarfs everything. About 1 in 2 out of 126 million adults are affected by musculoskeletal disease, arthritis, back pain, elbow, shoulder. Huge, huge amount. But a lot of times, a lot of money is not really put into taking care of that other than, hey, go have a surgery, get on this medicine, get an injection. I mean, obviously, cancer is horrible, diabetes is horrible, but a lot of the money, research dollars are poured into those conditions. And again, when you really look at it as far as percentage of the population affected, I mean, I could have a show of hands. Who here has a bad shoulder, a bad knee, a bad, you name it, back? You know, our hands are going to go up. But again, unfortunately, our medical community and kind of the way things are working in this country, we're not really overly concerned with preventing that. Here's another slide, just to break down. So 52 million adults, and these are old, this is maybe 2010 stats. 52 million adults say they have arthritis, 75 million are neck and low back. And I'm seeing neck pain go up with all the smartphones, the tablets. I mean, that's not getting any better. Technology is putting us in a position where we're not getting healthier. I mean, it's definitely more convenient for certain things, but it's not helping neck patients, definitely. A lot of musculoskeletal injuries. This is interesting. 1 in 2 women and 1 in 4 men over 50 will have an osteoporosis-related fracture. Osteoporosis is weakening of the bones. And that's why a lot of the products, I'll put a plug in for Healthy for Life, those omegas, those oils, you know, why is all the calcium leaching out of the bones? Well, if you don't have the right minerals, the right oils in your body, again, your body can't function. And the scary thing is, with a fall, and that's why we have the fall prevention class, there's a 20% mortality rate within 12 months of a hip fracture. So if you fall, there's a good percentage that, you know, you might not make it through a year. I mean, not to scare people. Yes, sir.
Many people have had a fall and broke and never recovered.
Yeah, and that's a great point, sir. They might not die, I mean, but they might not, you know, be able to get on the ground or go shopping or do things, stay independent. So, yeah, I don't need to show that next slide. We kind of talked about it. So here's some pictures that I'm a picture guy, but I have a lot of patients who come in and I'm like, I look at them, one leg is turned out, you know, if I have them lay down, one foot flops out, and they're just, their body is not, and they don't even really sense it. It's when your leg is turned out like this, and sometimes it's because you're bow-legged or have other issues, it makes it very hard to walk efficiently and function. So a lot of times what we work with in my clinic is trying to improve some of that. You know, a lot of times you're not gonna, if you've had it for years, you're not gonna make a dramatic difference, but there's ways you can strengthen certain muscles, maybe stretch other muscles, and that can make a big difference on how they're doing. This is what I see a lot with kind of our younger population. Here showing you, this is a back. I mean, these are back muscles. I mean, yes, you're supposed to have back muscles, but Brian, do you mind turning the lights down again, or Claire? I'm sorry. It depicts the overuse of muscles. Like here, you can see those are nice T-bone flank muscles there. You know, someone might think, wow, that guy is healthy, that's strong. But a lot of what we're seeing in the community is people are overbuilding muscles, and you're seeing it in their superficial muscles, but the stabilizing muscles that you don't see are underdeveloped, and those are the ones that help with balance, help with coordination, help with reducing pain because they actually stabilize the joint. This is interesting. You know, I look at people, you know, little arm swing, and I'm big into walking because I think there's a book called Walk Yourself Well, where the whole book just talks about learning how to walk properly. And it's amazing when you start to learn walking properly, how it can help so many things. And it's a simple thing. You don't have to do a lot extra exercises. You can just work on, you know, and this picture depicts this woman, you know, I kind of do this demonstration. I see a lot of people walk in my clinic, one shoulder's lower, and they walk like this. You know, they got arm swing on that left, but their right shoulder is basically frozen to their side. That our bodies were built for our lower body to rotate one way and our upper body to rotate the other. Most people have never been instructed on proper walking. But they go out, they might run, they might, you know, again, it's the fundamentals and basics. But, you know, again, it's not very sexy. You'd rather go out and lift weights and get big and strong, which I'm not saying getting strong is not important, but again, it's fundamental movements and how you do that. This is a picture of someone laying on their stomach. This is their left rib, this is their right rib. I mean, you would think the ribs would be about equal, but the left side is much more, I call hyperinflated. It's much more elevated, and that can have a big role on shoulder and neck pain and even lower back pain. So a lot of times conventional therapy would be like if you had a shoulder injury, you just work on that shoulder. For me, I look at the rib cage, I look at all these other factors because they're very important. I see a lot of this scoliosis. You know, here's some pretty significant cases of scoliosis, some slight scoliosis. You know, and everyone's going to maybe have a little bit of a slight scoliosis. And I'll touch on my little diagram here, my muscle chart, because the muscles in the diaphragm, the way it attaches to the spine, the way we breathe, the way we sit, we use a mouse, drive, can drive us into these patterns. So those are important to recognize. And then I see this a lot. One shoulder, this is like looking at someone from the back. I mean, one shoulder blade's up here. See you, Leslie. Go take care of the kids. And there's the right shoulder blade down there. Look at how much lower that right shoulder is than the left. What do you think, how do you think those neck muscles feel being so much lower on that side versus the other side? Do you think that contributes to their right arm being kind of stuck on their side when they're walking and then throwing off the amount of rotation in their upper body? All of this can be definitely, and I see it a lot with baseball players, swimmers, this, you know, right dominant athletes, but I see it with, you know, people just off the street who, you know, maybe they sit, you know, like this on their computer all day, you know, and don't even think about how they're sitting and the relationship of their posture to how that is manifesting in their body. And again, there's no right or wrong way to sit, but there's some fundamentals that are, well, there are rights and wrong ways to sit, but as far as when you look at posture, you know, I don't try to make everyone fit into one particular way, but I have some fundamentals that I kind of balance that off of, because everyone's going to be a little different. You know, women's hips are a little different than men's, and that impacts movement. I'm kind of moving through these so I can get to your questions, but again, stop me if I'm going too fast, but I really wanted to try to keep this to 20 minutes, but I can see I'm going a little longer, hopefully not that much. This is stress. You know, another factor, the first factor I said, you know, what is driving all this musculoskeletal pain and arthritis and low back pain? You know, what's contributing to this? Definitely how we're holding our body. We were not built to be sedentary creatures. We were not built to be behind a computer 8-10 hours a day. It's not. Our bodies, our DNA has not evolved to that point. And that's a problem because our sedentary lifestyle and the amount of stress that we're under throughout the day puts so much, I call it sympathetic overdrive, it creates so much inflammation in our systems. And we don't have a chance to unplug. You look at this, how does stress really affect the body? I'm just going to concentrate on the joints and the muscles. I mean, you could look at how it affects the brain. I mean, stress, and when I talk about stress, there are some good stress. I mean, they get you motivated, get you doing what you need to do, but prolonged chronic stress is not healthy for the body. It is not, you know. There is a reason, and I'll get, you know, we have Easter coming up. There's a reason why we have a Sabbath. I mean, rest needs to be built into our days. A lot of times, not enough, we're not getting enough rest. And so what you're seeing is increased inflammation, tension, aches, pains, and muscle tightness. And a lot of times, you know, it's not amenable. Tight muscles shouldn't always be stretched. I mean, you would think that's what we've been told. And that's kind of what I wanted to do this talk for. Kind of like what Brian's been so far ahead of the curve because, you know, the government, what did it talk about, you know, with nutrition? You need more carbs. I mean, I used to, years ago when I was in the Army, I used to eat a lot of pasta and I'd like gain weight. I'm like, I'm eating pasta. I should be losing weight. I don't even put sauce on it. So a lot of what is mainstream information, like you need carbs. You need a lot of carbs. You know, Brian came in and said, no, you need, healthy oils, you need proteins. Yes, you can use carbs, but they should be complex. So what I'm trying to say is you need to look at how you're exercising, how you're moving. I mean, a lot of what you'll see on news and on magazines, it's all about going to the gym and getting buff and working out really sweaty and hard. And I'm not bad-mouthing that exclusively, but there are other ways to strengthen your body in ways that don't increase the tension and the aches as much as possible. Ergonomics, I'll just touch on this quickly. I mean, this posture, we're not built to be parked behind, and laptops, I have one. Laptops are even more because you're in a narrow space, you're working here. I like, if you have to, get an ergonomic keyboard. If you're working exclusively with a laptop computer a lot, don't be surprised if your mid-back is tight all the time. This is not a healthy position to be in. And I'll touch a little bit on exercise. Like I said, I'm not bad-mouthing people who are at the gym or working out, trying to get stronger. But for a lot of us, using machines, not being educated on what the proper posture is, doing things that are not healthy for a joint. And, an 18-year-old's joint or shoulder is going to be a lot different than a 40 or 50-year-old joint. It just is. And you have to be a little bit more careful. So I understand why people want to get out. They want to do that. But they have to be very careful how they structure their exercise. All right. Standard treatments. And we'll just, like I said, we're going to really go by these quick. Opioids. That's been you have pain, you get that. I mean, and there just was recently in the news, someone was busted, doctors, dentists, pharmacists, for having some opioid scam where they were pulling people's teeth or writing prescriptions for people that didn't need them. I mean, again, it's really getting out of control, and the research shows it's not effective. Hey, Brian, I have this on, don't I? Okay, good. I just want to make sure. Sorry, I was a little late in there. This is an interesting book written by a surgeon, Paul Ruggiero, if you ever want to pick it up, The Cost of Cutting. So he's a surgeon who says, basically, and again, I'm not bad-mouthing surgeons, especially if they're watching on Facebook. Surgeries are needed, but there is a lot of financial gain to do some of these surgeries, which research and evidence have shown are not that much more effective than, maybe therapy, doing some other type therapies out there, physical therapy. Interesting book. Who has had a shoulder injection? Not very comfortable, going into a joint. And I'm not saying they don't provide a little bit of pain relief, but if, I had a client who had 10 or 12 injections into his shoulder. Eventually the tendon wore out. I mean, chronic injections can really weaken ligaments and tendons. All right, I'm going to go up into some of the alternative therapies and some of what how I operate and all right, we went over those pictures. I want to show one picture though, that really, and for females, Deb will appreciate this because a little inside joke with Kendi there. Yeah. Okay, she knows not to, but a lot of women, are taught to, or, like to stand kind of preferentially through this right leg, weighting their right dominant side. With that, what happens is that left leg really becomes not functional. It doesn't really contribute. So when you're walking and you're not really sensing that left leg and you're putting so much weight through your right leg, that can create a host of issues. I had a person come in yesterday and was like, my right neck hurts, my right foot hurts, my right low side of my low back hurts. We tested her. She had really not a lot of strength or even ability to sense or balance on her left side of her body. She had been putting all of her pressure through her right side. So the kind of therapy I use is postural restoration. It's one of the main things that I do. And what I do is try to restore posture, try to get the right and left sides a little bit more balanced. Now, asymmetry is I mean, it's built into us. We were created that way. If we weren't created that way, it would be really hard to like start walking. We're built to kind of center our weight through our right side, and then naturally we're going to want to swing our left leg through. Now, I teach a lot of my patients, let's try to reset our hips and our pelvis before we walk. Let's start with the right leg and left arm. And with that, it kind of helps get them moving and frees up a little bit of their motion. But this is what I see all the time with a lot of my young athletes or young patients, and a lot of them end up blowing knees out, ACLs, getting major injuries when they're 15, 16 years old. But this kind of posture and kind of a lack of awareness on that left side creates a major issue. And we'll do a little demonstration. Claire has graciously agreed to do a little demonstration later for us. I have a red cord machine, which I know you guys will look at this and say, what the heck is this? But what it does is it allows me to actually suspend people a little bit while they're exercising. And again, I don't start people on their stomachs. A lot of times I have people start on their backs because they have a lot of lower back pain. So what we do with that is we kind of take some of the pressure off the lower back and we try to strengthen either the right or left leg. We try to avoid fatigue. We try to maintain the correct position and get the right breathing, but also we don't try to exercise through pain. We do try to get their stabilizing abdominal muscles and pelvic floor muscles, which are important for keeping the pelvis in a great position. I would say 80% of my patients who come in with shoulder, knee, elbow, some type of pain or complaint, I usually go to their back. And a lot of times they'll say, I'm like, does your back hurt? And they're like, no, my back doesn't hurt. I'm like, okay. Is your back stiff? Well, kind of stiff. And I'll work with them. And they'll come back the next appointment and they'll say to me, you know what, I was really thinking about what you said on that first appointment, and yeah, my back really does hurt. So a lot of times what we'll do is we'll focus on their lower back, because if your lower back is really stiff and painful, you might have learned to live with it, compensate it, ignore it, whatever, but that's going to affect your hips, your knees, your upper trunk. So a lot of times we're doing exercises, we're just small exercises, where we're just trying to get the correct back muscles firing, the deeper ones with the abdominal ones. So again, a lot of people have the perception, and kind of like Tim said, you just go to physical therapy and you do just these boring exercises. Well, actually physical therapy, true, and I call it neuromuscular re-education, really works on taking the patient out of pain and firing the correct muscles in the correct sequence. And I think that's why we're just seeing musculoskeletal injuries just go up, because we're not really addressing it. And there's some good people out there, but again, the mainstream, I was not taught this in PT school 22 years ago. I had to go out and learn it on my own just to become more proficient and more successful. All right, here's the teaser. I said, hey, low cost secrets to staying healthy. And again, I'm trying to keep the prices down, but I kind of talk about positive mindset. And I was talking to Tim today, and we were talking a little bit about the placebo effect. And this is kind of a funny cartoon, but this doctor says, take 2 Skittles and call me in the morning. And then he says, new reports claim 50% of doctors have prescribed placebos. And more about what this talks about is having a mindset. And Tim's introduced me to, Bruce Lipton and a lot of these researchers who really understand the importance of our brain and our mindset. Because what do most of us think, and we haven't been educated on what pain does, how does pain impact us? I mean, it does make us suffer, unfortunately, but a lot of times if we have the mindset of, this is never going to get better, I'm doomed, I'm old, this decline is just part of it, I can't escape it. Unfortunately, if your mindset is that fashion, I don't care how good a therapy we do, a lot of that, and this is the hard part. And sometimes that's why I get a psychologist or someone who is really trained and proficient in this to kind of help me, because it really makes a huge difference. This is an interesting book, Consciousness and Healing. It's written by Marilyn Schlitz, not Schultz, but it kind of talks about all these approaches to mind-body medicine and consciousness. And it does have a lot of research in like healthcare, psychoimmunology, spirituality, prayer, environmental health. It's very fascinating because, and again, not going to get into a big spiritual discussion or a big religious discussion, but the research really shows having a community, having a spiritual practice really helps sometimes reverse those mindsets or helps support a more positive mindset. So, you know, the cancer research studies that I've looked at where people have been involved in a support group with kind of, you know, and a little spiritual component to it versus a person who's just kind of getting cancer treatment in isolation and looking at their outcomes and their life expectancy. It's amazing how much it improves that. And again, you guys probably all understand that. That's not anything new, but I think sometimes we need a reminder that, you know, our brain defaults to negative. Our brain is built on threats. So it's easy to fall into that, oh my gosh, what is going on? You know, is this gonna just forever spiral out of control? Am I ever gonna get better? Is all hope lost? And when that happens, it really makes it difficult to get some of these treatments that we're undergoing to be successful. So again, I don't want people to think I'm really a big believer in like placebos, but there is research. It's not really the placebo, it's more it is the placebo, but it's more impacting that you have some control over this, that your mind body has what your mind sends and your signals can have a real impact on your hormones, your immune system, and your response to pain. This is now, yes, sir. Yes.
There's a really cool video called The Placebo Effect on YouTube. I don't know if it's YouTube, but on the internet, where an orthopedic surgeon did surgery on 7 patients.
Mm-hmm.
Except for 2 of the patients, he set up for surgery, made the incision, did nothing in the knees. So you have 5 surgeries and 2 people you didn't. They visited them 5 years later, and it's 5 years, I think it was. They go up to their house, and the husband and wife, and these are people that would have been looking at knee replacement, arthritis, everything like that. They visited them at their house. The husband and wife were on their way out to dance. And the man that was there had nothing done to his knee, except he believed that the orthopedic surgeon did surgery on his knee.
They can do that. That's interesting.
That's placebo.
Yes,
That's
ma'am.
the power of the mind.
Yes, Deb. Thank you, Tim.
My husband was a patient at MD Anderson Cancer Center in Houston in 2008. Came through a horrific surgery, chemo and radiation, with tremendous results as compared to other people in a classroom setting that we were in on a daily basis. And they pulled him out and used him as an example, back to what you're saying, mind, body, and spirit. And they said because he was strong in these 3 areas, that it allowed his body to respond to the treatment that they were giving him.
Those are great. Thank you, Deb, for sharing that. Yeah. So again, and that's low cost. Isn't that free? I mean, there's no cost for keeping a positive mindset. I'm not saying it's easy. I kind of default to, you know, glass half empty. But it's a good thing I'm surrounded by these good people next door and my wife here who had to go to kind of keep me in that focus because, yeah, I mean, it's critical. Now, sleep, 7 hours minimum, you guys might laugh, you know, is that practical? But I'm telling you, if you're not getting 7 hours minimum, and I know there's extenuating circumstances at all age groups, I mean, it really makes a huge difference. And a lot of times this goes out to our younger crowd because, you know, they feel like they can live on less when they really can't, or even, you know, you're just trying to get too much work done. Again, sleep is free, somewhat free, and it's amazing. And these are just a couple tips. Limit electronic usage. I mean, if you really want, go to this. I found this woman yesterday, tarabrock.com, and we'll work on getting some information or some of these slides out there so you guys can reference it on my Facebook page. I apologize I don't have print out handouts today, but it just didn't work out. But Tara Brach has a whole thing, if you go .com/sleep support, on just really great tips for improving sleep. And I mean, I'm telling you, if the investment in trying to improve in that area will pay huge dividends. Breathing. This is an interesting book. Maybe some of you guys have read it. The Relaxation Response by Herbert Benson, written in 1975, a physician. He really got it back then, and he really worked on people's breathing and really worked on trying to inhale properly, exhale properly. Now there's so many free apps out there. Robin's a guru on the breathing. I know she really works a lot on that. But it's amazing if you learn how, and everyone breathes a little differently. I would say, though, there's fundamentals about, and what I really talk to my patients about, or my clients, is minimize the upper shoulder activity. Try to breathe laterally. Most of us think about belly breathing, but our rib cage is very circumferential, which means, it's like a barrel. And we're designed to breathe out into the sides and into the back. So we might go through a little demonstration on that will touch on that. But I'm telling you, investing time, and there's apps, there's people out there who are like guru experts on breathing. It's free, and it can make amazing difference if you're doing it correctly. Now, if you're using a lot of your neck and shoulder muscles and kind of really belly breathing, which a lot of instructors used to teach, like really get that belly out there, take a deep breath. I mean, that can really reverse a lot of the parasympathetic or healing response that Dr. Benson was talking about. And it's amazing how breath, and I think that's why yoga is becoming more popular, because of their focus on, breathing and proper breathing. So I think it's powerful, but you wouldn't think of it. And a lot of conditions out there are actually, it's called like breathing disorders. It's not really a disease. It's not like diabetes or cancer. But if you're not breathing efficiently and effectively, I mean, that's what you get your oxygen to your cells. Obviously, the essential oils through here help a lot. But if you're not truly tapping into proper breathing, you're not going to maximize those. Very free. I like free. Ergonomics. And I'll make sure you guys get this through Facebook or, get that posted. These are some tips that we look at. A lot of times what I tell people first is not to do, if you're holding a child, you're holding your grandkids and you're just loading them through your right side and you're not you're shifting all your weight down to that dominant side, that can cause some issues. I mean, if you lock your knees when you stand, if you shift your hips and just blow through your ligaments, yeah, that can be a problem. So a lot of the tips I tell people, stagger your left leg back, put weight through your left leg, reach with your left arm when you're reaching into a cabinet. I'm not going to encourage you to walk backwards on the stairs. That would probably not be a good idea. But if you can start to use your left side a little bit more and use it effectively, that's going to be important. Sitting in a chair, I see so many women, and I'll pick on women who their feet won't touch the ground because chairs are designed for men, 5'11" men. So a lot of times I'm saying use a footrest. Make sure you have some contact. The ground is there for a reason. It provides a stable surface for you. And if you're just tucking your knees under, you're losing your pelvic position. I see people not utilizing their backrest or sitting too stiff. I'm not a huge fan of crossing your left leg over your right. And that goes into what I talked about, that asymmetry. I'll turn on the light after we do that, and I'll show you why our body's a little bit set up differently, and that will explain why I don't really want you sitting that way. You can cross at the ankles if you struggle to cross that right knee, but crossing your left leg is kind of like I joke people who sleep on their stomach with their left leg up like this. Or in the Heisman. If you sleep in the Heisman, I know it might be comfortable, but it's leading to that shift into that right side. And that, you do that 6-8 hours a night. Don't be surprised when you run, if you get up on that left leg or walk even, and you feel like, ooh. And it usually doesn't even happen consciously. It happens subconsciously that you fall.
What is the damage from the left leg crossed over the right? What does that do?
Well, what I see, a lot of times it loosens up the hips, but it drives, you got to remember the pelvis and the hips. Claire, do you mind hitting on the light? That's a great question, Rob. I'll use my old pelvis model. So if you're like this sleeping, you're driving your pelvis to the right, your spine naturally follows that. That's why chiropractors are popular. They're helping people to get back into position. But if you knew this is your default position, there are certain simple exercises, and just like I said, standing on that left leg behind you, reaching up, while you keep your weight through your left hip. This is what I was talking about with the diaphragm. This is your diaphragm, which sits underneath your rib cage. Can you guys see? Sorry. This might be a little hard for you to see. I apologize. But what I'll tell you is the right diaphragm rises larger on the right side. It has a larger attachment into the spine. So with every breath, you're being pulled like that. Now, I work with a lot of accountants, actuaries. I mean, this town is insurance driven. I call it a lot of left brainers. The left side of the brain controls the right side of the body, fits into that pattern. So it drives you further and further. So yes, it's comfortable to sleep that way. It's comfortable to cross that leg, but don't be surprised if I test you and I ask you to stand with your right leg up, you're not centering, and you're in yoga, so you probably be pretty good. But a lot of people, they really struggle. They lift this leg up and they go like this. And when you're trying to walk and you hit a patch of ice or you hit something slippery, if your center of gravity is already over there, you're gone. You're going. You don't have any correction. And that's why they study the Chinese who do Tai Chi and move like this and shift. That's why Tai Chi is so powerful, is because they make you go on each side of your body. And so when they lift their leg, they don't commit all their weight to the left side. They leave a little bit on that almost right side. So if that left leg goes, they're boom, they're by. And that's proven. Another couple things, you have 3 lobes of lung on your right, a larger liver on your right. You have a heart on your left. It's asymmetry. We were created. It's not a mistake in a sense, because if we weren't asymmetrical, we would never be able to initiate kind of walking and gait. The problem is mousing on the right, doors on the right, keychain on the right, doing a lot of right-sided activities, not understanding how sitting on your right butt cheek all day and not feeling that left sit bone impacts the stability through your system. And that's a big, big thing. Claire, do you mind hitting the lights? Great question, Robin.
What is the best way to sleep then?
Oh, we got the picture here. Thank you. But again, everything's a little bit different. If people don't have shoulder issues, rather they sleep on their left side, even maybe a pillow in between here, and we could have a long conversation. So much for my 20 minute talk here. But and in a little pillow through the knee. So I like some support through right between your rib cage and your hips, because with unless you have a really good mattress, if you're sleeping in memory foam and other things, your spine's going to kind of curve, and that's going to throw off your hips and your pelvis. So I would say that position, if you go, I can't sleep on my left, I would say try to sleep on your right side, but try to keep your left knee behind your right knee. That's a side view. Again, and I put a little towel in between kind of the bottom of the ankle. Now, for some of you, you're going to have to sleep on your back, or sleeping on your stomach, when I get a young person in, it's like, oh my gosh, that's going to be a lot of work, because you lay in this position, you're hyperextended. So to answer your question, I prefer left side, pillow knee, a towel or something in between your side, and don't get me started on mattresses, but that would be a whole another talk. But I mean, you're in a mattress for 7-8 hours, hopefully 9, and it's got to be good. And I don't see that all the time. This is something called Nordic walking. Well, we don't have to turn on the lights yet, but we'll demo it at the end. But these poles, $20 or $24 at Walmart. If you guys have been over to Europe, This is huge. Why I like this is for people with balance issues, it gives them a little bit of stable support. I've had people who come up to me, I can only walk like a quarter mile. With the poles, they can walk up to like a mile, mile and a half, because it provides a little bit of support. It also gets those arms alternating, reciprocally moving, and if you press down a little bit, it gets those core muscles activated. So I really advocate, and again, there's Nordic walking websites. It's just, it's powerful to see. And a lot of people, maybe you've been to Arizona or hiking, it makes, a lot of people like, well, I'm not out in the mountains. Well, you can walk on trails with these. Like I said, if you try it, I think most people are surprised with like, oh my gosh. And it really does promote. Yes, Tim?
What's the reduction of stress on the lower joints, John, with using poles?
What have you heard?
I've heard 30%.
Yeah, that's what I've heard, 30 to 35%. But a lot of times what's even more, two things which I think are more critical is more core activation. You have 4 layers of ab muscles on your sides. By doing that, a lot of times you're getting more transverse abdominis, internal obliques, even some of the muscles running into the pelvic floor. The other thing, it gives confidence. So many people have fear of landing, of walking, and that fear creates so much tension in the lower back, because breathing is important. The other important, preventing falls. And I see it all the time. I have patients come in here all the time, and I'll have them walk in my clinic, and I'll be like, are you afraid of falling? And they're 40, 45, 50 years old, and they're like, yeah. And they're kind of embarrassed. I'm like, you don't have to be embarrassed. And so we'll work on, I'll give them some poles, and they're like, are you less afraid of falling? Yes. How does your back feel now you're less afraid of falling? Better. And then again, just that thought of when we think of walking, the upper trunk is equally important as the lower trunk swinging, but it has to be synchronized, and it has to be in a fashion that is correct. And that's not why, I'm not seeing that a lot. And that's why I said low cost, $20, $24 at Walmart, 100 at REI. And of course, reduce inflammation, omegas, you guys know all this, but I look at this, the investment in this as huge. This has helped so many of my clients with pain and just overall, the combination of the healthy omegas, with the minerals, and then if, you don't eat whole food 30 clean, you probably need something like that. But I appreciate Dave coming in and telling, because, I did really emphasize with that. And I think that was as equally important as healing his hip as what I taught him about movement. So very important. Theracane. This is something, it is funny. It's like a $30. I have it, I should have brought it over. But what it is like a shepherd's crook that you can do self-massage. And I'm telling you, everyone has trigger points in their upper neck and lower back, and for just a little cost, and I love massage therapists, but $80, $90 a massage, that adds up. So, oh, I love this. Lazy River, Clive Aquatic Center. There's one in Ankeny. There's one in West Des Moines. I'm in there some mornings, 6, 7 o'clock at Clive. It's like $2, $3. And it's amazing walking in water, unweighting yourself. You can work on some of this stuff that I talk about walking. And you're not afraid of falling, because when you fall in the water. Or I'll walk sideways. I'll walk backwards to increase my glute strength. And then, funny, I'll have like a crew of people kind of following me around the pool. I take my business cards. No, I'm just kidding. But, I guess I've been pretty serious through this talk, but it's because, again, like I said, it really, to see people suffer, and they come in every day. It's hard to see people suffer every day, but it's so empowering when all of a sudden someone comes, I was able to pick up my grandkids, or, I was able to walk a half mile or a mile with my husband last night. And I really think, like I said, do we really tap into these low cost options to stay healthy? And not everyone wants to get in a pool, and I think they have, near the Clive Aquatic Center, they have a HydroWorks pool in the Walnut Creek Retirement Center where it's an underwater treadmill. I would love in my clinic next door to put something like that in. I don't think Anderson Properties, my landlord, will let me, but water is very therapeutic, and you guys probably know that. This is funny, zero gravity chairs. Gravity, believe it or not, it's kicking our butt. If we didn't have gravity, I mean, you know, we wouldn't be able to survive, but the effects of gravity, and I work with teachers and hairdressers and people on their feet all day, and it takes a toll on them. You know, I just looked at Amazon, $58, you can get a couple of these for 2. And so I used to have at my old clinic, I'm researching the best one, but a lot of times what I'll do at the end of a PT session, I'll put a person in this chair, I'll put a biomat, which is a super incredible healing, Tim knows it, device, and get them some heat, get them just with their legs. Now, if you have a recliner at home, you can kind of accomplish the same thing, but it's amazing what happens when you reverse gravity. This is an interesting article. I just saw this. It's in brainpickings.org if you want to take a picture of it. It talks a little bit more about the mental component, but it's fascinating about spirituality and about community. That's the main thing that I wanted to talk about is, you know, getting plugged into a community like Healthy for Life. I mean, that is, you don't think about that, but what Tim and Brian are trying to create here is, I mean, it's big. I mean, it really, and it's not, you know, you go to California or out the East Coast, I mean, there's just all these centers. Even now in Iowa, Dubuque has, I mean, we're kind of like a late developer to kind of, and I know we've had places here before, but it really hasn't caught on. And just the cost of finding a community, and you guys maybe are already plugged into some, but it's powerful. And then to plug into a community with a lot of health knowledge and passion towards it, I think are going to be really helpful for the community. So I'm going to, you know, like I said, you guys have been really good. If you want to turn on the lights, the one thing that I will say is, I'm not really saying, hey, you got to come and see me, and again, it gets complicated sometimes with insurance and other things, but I am putting out a fall prevention class starting April 29th from 10 to 11:15. We're going to have 8 total sessions. We'll break over the Memorial Day time. It's going to be right next door, and I'll give you guys a tour if you want of my place. And Andre Delaney is a certified master trainer, and he's going to be kind of honchoing it. It's a program I came up with, developed, but I have so many rehab patients. It's just hard for me to break away to do it. But I mean, I'm going to be keeping an eye on it. So, but it's something that we're going to start. Usually it's a little more expensive, but we're dropping it to $199 for 8 classes. And we're going to keep it small, just 8 participants. I do have some flyers here, or you could, just if you haven't put your name on that notebook, then, if you put your name in the notebook and asterisk, we'll get your email. And like I said, if you pay by April 25, it's going to be $199. So we're really trying to make it, a low cost per class kind of thing. But we want to work. The goal of it is when you come out of it, you're going to feel more confident. You're not going to, you're going to learn about fall prevention. You're going to be assessed in the beginning. You're going to be kind of assessed at the end to look at it. And unfortunately, as we age, our balance doesn't get better unless we really focus on it. And they've shown Tai Chi. I mean, the science behind in a lot of our program is somewhat based on that. It involves breathing. I'm not going to say it's going to save you from anything happening, but that is a passion to try to prevent those kind of injuries. Let's do this. Claire, do you mind coming up here? I just want to show you, everyone thinks about, when I talk about this, get on the table here, a lot of this pelvis, Brian's moving over here. Now you have a little bit of knee pain, right? A little bit of knee clicking. Not really on the left side as much, do you? No. So you're perfect here. So going into that whole, hips, pelvis shift in this way, you don't even think about it. Every breath you take, little twist. Low back, twist to the right. Mid back, because it's a column. You're not going to stand like that. So what you're going to do, boom. Upper trunk's going to rotate. Head goes the opposite way. Scoliosis. I mean, a lot of that is torsion in the spine. That's a lot of why we have a lot of tightness in the neck. Do you have some neck tightness and some stuff into here? Mm-hmm. That's why walking, it's not as easy to swing that right arm. So like when I take a look at a patient, I will have them kind of go, I'll test their leg here. I don't know if everyone can see it. Hold this up here. Try to get out of the way. Don't let me push down. So I can move that leg pretty easy. Hold this leg out here. Don't let me push down. And I'm using equal force. Isn't this leg a lot harder to, relax that, a lot harder to resist me? Okay, pull this underneath the table. Don't let me pull forward. So I'm testing her hamstring. Pretty easy to pull it away. Don't let me pull this one. Okay, so again, there's a little bit, yeah, that's perfect right there. So with this tilting with that, what that really impacts is her ability to activate muscles and to fire muscles through that left side. So Claire, do you want to stand up right here for me? You're doing great. Stand like sideways, a little bit over here. All right, so what I want you to do, hands out like this. Lift, we'll see, I haven't tested her on this. This could come back and bite me, but lift the right leg up to balance, I'm sorry, left leg. Lift that leg up. Good. So she's able to center over here. She's listing a little bit to the left, or to the right, not bad. Now put that one down. Now lift the left leg up. Or right leg, excuse me. I'm just going to keep her from listing. That's pretty hard. Do you notice how her upper body is kind of shifting over there? That has,
Small children.
pardon? And that is true. Now, when you have children, what do the hips and pelvis do? They widen, the core muscles. And I always feel like every woman who has thanks Claire, it's perfect. Yeah, I'm not going to fix you yet, but we'll work on it. I will work on you. Every woman who has a baby should really go to physical therapy afterwards. I mean, I feel like it because all the ligaments stretch, their core gets out of whack, their lower back gets out of whack. And again, a lot of them will go right into exercising, like my wife's niece. I saw a picture of her on Facebook. She's in Germany, just had her second child. She wants to do a marathon after having her second baby. And it's taken me, I want to call her, I want to stop her, because I saw a picture of her running, and she was running, and her knee was just doing something that was just horrendous. I mean, it was like her knee was going into the right, her knee was like this, her foot was out to the right. It was a mess. So there really is help for people, and it always starts with kind of awareness. And, I didn't have a huge crowd tonight. I love that you guys showed up, and I appreciate it. But hopefully through Facebook and, getting out there, or in the YouTube channel, I feel like my message is somewhat unique in how I present it. So I feel honored to do that. We're a great audience. Are there specific questions, what I addressed in here, before I maybe open it up to a little bit of quick little tour of my space next door? I appreciate you guys staying awake, staying attentive. That's a great question. Well, I mean, I think it starts with the assessment in the medical history form. I mean, I usually send my patients a medical history form, which they fill out, but again, it's not exhaustive. And so I get some of that information from them, and I really want to get to know them. I start asking them questions, as far as, and I start to see patterns. So I want to learn more about them and, their goals. What is your real goal for therapy? What do you really want to do? And then trying to pull out some of their fears and some of their, maybe have they had good experience with therapy, or maybe they've had poor experiences, and just to see where they're at and see what their overall health history, because you can start to see patterns with, if they have diabetes, or, if they had certain type of injuries. So I think it starts with that, but you got to develop some rapport. And you start a lot of times I'll just start with let's just work on some simple breathing, and let's start on something easy. But I do want to educate them about, like I did today, about how the body is different, it's asymmetrical. And because a lot of times it starts with awareness, because a lot of people are not aware of how they do. And one thing I'm glad you said that is that I didn't touch on is important learning about breathing. The other thing I think for most people, you have to get on a table or whatever, even lay in your bed and I call it, do a body scan. like, where is the tension in your body? Is it in your jaw? Is it in your back? Is it in your knee? And so many of us just block out the sensations from our body. And yeah, you can do all this breathing and this exercise, but until you kind of link your brain with what's going on overall with your body, it's just not effective, you know, because then do your breathing work and then go back to your body scan or tension scan or stress scan, whatever anyone calls. And how did that change? How did just modulating your breathing, or how did, you know, interacting with an empathetic, and I think that's the key, is empathy. You have to be, as a provider, empathetic towards them. You can't just look at them like, oh my gosh, they got a laundry list of complaints, or, you know, I'm running behind. I mean, that's the hard thing now with, you know, in insurance and stuff. Care. I'm trying to think. You guys were great. I know it's tough traffic. Well, I want to wish all of you a happy Easter and a great holiday. And I have some cards up there. I got the balance flyers if anyone's interested. No pressure. But I think that might be something for either yourselves or friends or family. Everyone knows someone who's maybe struggling a little bit with balance. But is there any interest in no pressure? I'm not going to be hurt. I can take my dad out to dinner if not. But if anyone wants to walk next door, I did want to show Megan real quick, you know. But does anyone else want to walk over there? All right, let's go over.